If you're anything like me, these last few months have been rough for you because you've been getting over the cold, your child has been in contact with RSV, upper respiratory, or even the flu. Well, I am bringing you this informative speech to inform you about the guidelines and sanitations that are put in place for safety and sanitation at the Child Care Center. First and foremost, these things are common to go around the Child Care Center. It doesn't mean that your center is dirty, but to help reduce the spread of these things, we want to make sure that we are practicing proper hand washing procedure, cleaning and sanitizing surfaces as much as possible. And if your child has any signs and symptoms of illness, please keep them home. Hand washing, according to the CDC, reduces 23 to 40% of illnesses that include diarrhea or with the stomach bug or anything of that sort, and upper respiratory decreases it by 16 to 21%. So just hand washing alone, proper hand washing alone will help so much. So proper hand washing is using warm water, soap, and washing your hands for at least 20 seconds after using the bathroom, after changing a diaper, when you first come in the morning, when you go from outside to inside, after use of the sand and water tables. When in doubt, just wash your hands. Second, we want to make sure that we're cleaning and sanitizing all surfaces as much as possible. After diapering, you want to make sure you use a mild soap and warm water to first clean the surface down. And then we want to follow that by using disinfectant such as bleach and water solutions to spray it, leave it for 2 minutes at least, and before we wipe it and let it air dry. Follow that. We want to do that after diapering. We want to make sure we do that before and after. Again, meal times, we want to make sure we're doing that after every use of the cot. We want to make sure that we're cleaning and sanitizing blankets, linen, soft toys in the laundry weekly. And we want to also make sure that we're at least cleaning the soft toys and shampooing our carpets with steam in the dishwasher and using a steam mop or shampooer at least once a month. Last but not least, if your child is showing any symptoms of illness, please keep them home. A lot of centers have their own guidelines and procedures that they do follow. However, they're most likely to get them from the American Association of Pediatrics. So if your child has a fever of 100.4 or higher, if your child has 3 or more PMs, or if they're just not up to doing their day-to-day activities, please keep them home. So proper hand washing, cleaning, and sanitizing surfaces, as well as keeping your child home when you notice signs and symptoms, can help reduce the spread of these illnesses in child care centers. Thank you.